Question 1. A patient who is confused begins to get out of bed unassisted. What is the PCT's immediate priority action? A. Quickly check the patient's footwear. B. Encourage the patient to sit back down and call for help. C. Apply a restraint to prevent a fall. D. Document the patient's behavior. Answer B. Encourage the patient to sit back down and call for help. The core concept is patient safety and preventing falls, especially with confused individuals. The keyword immediate priority highlights the need for the quickest, safest intervention. While checking footwear or documenting is important, the first action should be to try and prevent the patient from falling now. Restraints are a last resort and require a physician's order, never the first action. A practical tip: always try direct, gentle interaction first when a patient is attempting an unsafe action. Question 2. When is hand hygiene the most critical step for a PCT? A. After touching a patient's chart. B. Before applying sterile gloves. C. After removing gloves and before touching the patient again. D. Before answering the phone. Answer C. After removing gloves and before touching the patient again. This question tests understanding of the critical moments for hand hygiene to prevent the spread of infection. Removing gloves means potential contamination, and the keyword most critical points to preventing transmission between patients or from the environment to the patient. Touching the patient's chart or answering the phone requires hand hygiene before or after, but cleaning hands after removing potentially contaminated gloves is paramount to patient safety. Think of it like this: always wash hands after potential exposure and before the next interaction. Question 3. A PCT obtains a radial pulse of 110 beats per minute for an adult patient. Which action should the PCT take next? A. Immediately report the finding to the nurse. B. Recheck the pulse in 15 minutes. C. Document the pulse rate and continue monitoring. D. Ask the patient if they feel anxious. Answer A. Immediately report the finding to the nurse. The question focuses on interpreting vital signs, specifically a pulse rate of 110 bpm, which is considered tachycardia, fast heart rate, in adults. The keyword next requires identifying the proper follow-up action. While asking about anxiety is relevant, reporting it to the nurse is the priority because a rapid pulse can indicate underlying issues needing prompt medical assessment. Rechecking later or simply documenting might delay necessary intervention. A good reminder: elevated or unusually fast vital signs always need to be reported promptly to the licensed nurse. Question 4. When assisting a patient with a weakened left arm during dressing, what is the correct procedure? A. Start by putting the sleeve on the right arm first. B. Start by putting the garment on the weaker, left, side first. C. Ask the patient to dress themselves completely. D. Pull the garment over the patient's head without assistance. Answer B. Start by putting the garment on the weaker, left, side first. This question assesses knowledge of assisting with activities of daily living, ADLs, specifically dressing a patient with unilateral weakness. The key principle is to dress the affected side first and undress the affected side last to minimize pain and effort. Putting the sleeve on the weaker arm first allows the patient to use their stronger arm to help guide the garment. Asking the patient to dress themselves completely might not be possible given the weakness, and pulling without guidance could cause discomfort or injury. Remember to always start with the affected limb when dressing to make it easier for the patient. Question 5. A PCT is assisting a patient with ambulation using a gait belt. Where should the PCT stand? A. Directly behind the patient, slightly to the side. B. Directly in front of the patient, facing them. C. Beside the patient, on the side they are less likely to fall towards. D. Slightly behind and to the side of the patient, within arm's reach. Answer, D. Slightly behind and to the side of the patient, within arm's reach. This question tests proper body mechanics and safety during patient ambulation using a gait belt. The keyword stand refers to the PCT's positioning for optimal support and safety. Standing slightly behind and to the side allows the PCT to safely hold the gait belt, provide support if the patient stumbles, and guide them forward without obstructing their path. Standing directly in front could lead to a collision, and standing beside them without being behind offers less protection against forward falls. Always position yourself slightly behind and to the side, ready to support your patient's center of gravity. Question 6. A PCT needs to collect a midstream clean catch urine specimen from a female patient. What is the first step after explaining the procedure? A. Have the patient void a small amount into the toilet. B. Place the sterile specimen cup inside the collection container. C. Apply clean gloves. D. Ask the patient to start urinating into the sterile cup. Answer, C. Apply clean gloves. This question focuses on the initial steps of specimen collection, emphasizing infection control and procedure accuracy. The keyword first step is crucial here. Before any patient contact or handling of supplies, the PCT must ensure their own safety and prevent contamination by putting on clean gloves. While having the patient void first is part of the clean catch process, and placing the cup correctly is vital, donning gloves precedes these actions. A good habit to form, always put on gloves before you begin any procedure involving potential contact with body fluids. Question 7. A patient's family member asks the PCT for details about the patient's diagnosis and treatment plan. What is the PCT's appropriate response? A. Let me get the nurse, they can discuss the medical details with you. B. The patient has a condition called pneumonia, which is an infection in the lungs. C. I'm not supposed to discuss patient information, but everything is fine. D. You'll have to wait until the doctor comes in to find out. Answer. A. Let me get the nurse, they can discuss the medical details with you. This question addresses patient privacy and the boundaries of a PCT's role concerning information disclosure, governed by HIPAA, Health Insurance Portability and Accountability Act. The keyword appropriate response requires choosing the most professional and legally compliant action. PCTs are not authorized to discuss specific medical diagnoses or treatments. That responsibility lies with licensed nurses or physicians. Option A correctly redirects the family member to the appropriate person without being dismissive or violating privacy. Remember, when asked about patient details you shouldn't share, always find the nurse. Question 8. A patient has tuberculosis, TB, which is transmitted via airborne droplets. What type of transmission-based precautions should the PCT use? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Answer, C. Airborne precautions. The question tests the knowledge of applying specific transmission-based precautions based on the mode of pathogen spread. The key information is tuberculosis, TB, and airborne droplets, directly indicating the need for airborne precautions. These require a special N95 respirator mask for the healthcare worker and placing the patient in a negative pressure isolation room. Contact and droplet precautions are for different types of infections, and standard precautions alone are insufficient for airborne diseases like TB. Always match the precaution type to how the specific disease spreads. Question 9. Which finding requires the PCT to adjust their technique when measuring a patient's oral temperature? A. The patient just finished drinking a cold beverage. B. The patient is wearing a clean hospital gown. C. The patient is lying flat in bed. D. The patient's skin is warm to the touch. Answer: A. The patient just finished drinking a cold beverage. This question is about the accuracy of vital signs measurement, specifically oral temperature. The critical clue is adjust their technique and the action of drinking a cold beverage. Consuming hot or cold liquids affects oral temperature readings, making the measurement inaccurate. The PCT must wait at least 15 to 30 minutes after the patient drinks or eats before taking an oral temperature. The other options do not directly impact the accuracy of an oral temperature reading. A good tip: always ask about recent food or drink intake before taking an oral temperature. Question 10. A PCT notices a spill on the floor in a hallway. What is the most appropriate immediate action? A. Clean the spill immediately using appropriate supplies. B. Put up a wet floor sign next to the spill. C. Inform the charge nurse about the spill. D. Step over the spill and continue with assigned duties. Answer: B. Put up a wet floor sign next to the spill. This scenario tests understanding of facility safety procedures and preventing accidents. The keyword immediate action focuses on the first step to mitigate risk. While cleaning the spill, A, and informing the nurse, C, are important follow-up steps, placing a warning sign, B, is the first priority to prevent someone else from slipping and potentially falling while the spill is being addressed. Ignoring it, D, is unsafe. Think safety first, warn others immediately, then handle the hazard. Question 11. When assisting an elderly patient with dementia to use the bedside commode, what intervention promotes dignity and independence? A. Performing all steps of the toileting process for the patient. B. Rushing the patient to finish as quickly as possible. C. Allowing the patient to perform as many steps as they are able, with supervision. D. Leaving the patient unattended on the commode for an extended period. Answer: C. Allowing the patient to perform as many steps as they are able, with supervision. This question centers on promoting patient dignity and independence during activities of daily living, ADLs, particularly toileting for someone with cognitive impairment. The keywords dignity and independence guide the answer. Allowing the patient to do what they can, with supervision, respects their autonomy and helps maintain their abilities. Options A and B are disempowering, while option D compromises safety. Remember, encourage self-care as much as possible to maintain the patient's dignity. Question 12. A PCT is preparing to turn a dependent patient onto their side. Which action is essential for preventing skin shearing? A. Applying lotion liberally to the skin before moving. B. Pulling the patient up in bed towards the head of the bed. C. Lifting the patient completely off the bed surface during the turn. D. Loosening the draw sheet under the patient before moving. Answer: D. Loosening the draw sheet under the patient before moving. This question addresses patient positioning and preventing skin shearing, a common complication in dependent patients. Skin shearing occurs when layers of skin rub against a surface. The keyword skin shearing is the primary focus. Loosening the draw sheet allows the skin to move with the sheet, rather than dragging across the bed linens, which causes shearing. Pulling the patient up without loosening the sheet, B, causes shearing. Applying lotion, A, doesn't prevent it during the move, and lifting completely, C, might be necessary but doesn't specifically address shearing prevention during the turn itself via the draw sheet technique. Always use draw sheets correctly to protect the skin when repositioning. Question 13. A PCT collects a urine specimen at 10:00 a.m. and needs to send it to the lab. It will take 2 hours for the lab to process it. What is the most appropriate storage method for the specimen until it's sent? A. Leave it on the patient's bedside table. B. Store it in the refrigerator. C. Place it in a biohazard bag and leave it at room temperature. D. Pour it into a secondary container for transport. Answer, B. Store it in the refrigerator. This question concerns the proper handling and storage of biological specimens to maintain their integrity. The keywords urine specimen and 2 hours indicate the need for appropriate temporary storage. Refrigeration, B, is the standard method for short-term storage of most urine specimens to slow bacterial growth and chemical changes that could alter test results. Leaving it out, A, C, can lead to inaccurate results, and pouring into another container, D, isn't the primary storage method unless specified for transport. When in doubt about specimen storage, refrigerate it unless instructed otherwise. Question 14. A PCT observes a patient becoming increasingly short of breath and restless. What is the most important action the PCT should take? A. Ask the patient to take slow, deep breaths. B. Check the patient's vital signs immediately. C. Report the changes to the nurse promptly. D. Offer the patient a pillow to lean on. Answer, C. Report the changes to the nurse promptly. This question tests the PCT's role in recognizing and reporting changes in a patient's condition. The keywords increasingly short of breath and restless are critical signs that require immediate attention. While checking vital signs, B, or offering comfort measures, A, D, might be part of the response, the PCT's primary responsibility is to communicate significant changes to the licensed nurse without delay, allowing the nurse to assess and intervene appropriately. Prompt reporting ensures timely medical evaluation. Always report any sudden or significant changes in a patient's condition to the nurse right away. Question 15. In many healthcare facilities, the RACE acronym for fire safety stands for rescue, alarm, confine, and which other action? A. Evacuate. B. Extinguish. C. Check equipment. D. Clear hallway. Answer, B. Extinguish. This question tests knowledge of standard fire safety procedures using the RACE acronym. The keywords are RACE acronym and fire safety. RACE stands for rescue patients in immediate danger, alarm/activate the fire alarm system, or call for help, confine the fire by closing doors and windows, and extinguish the fire if possible or evacuate the area. Knowing the sequence and meaning of each step is vital for responding effectively to a fire. Remember the order: rescue, alarm, contain, extinguish/evacuate. Question 16. When measuring a patient's blood pressure using a manual cuff, the PCT inflates the cuff and then slowly deflates it. At which point should the PCT note the systolic blood pressure reading? A. When the cuff pressure reaches 180 millimeters of mercury. B. When they hear the first clear tapping sound, Korot cough sound E. C. When the last distinct tapping sound disappears. D. When the needle on the gauge returns to 0. Answer B. When they hear the first clear tapping sound, correct cough sound D. This question assesses the specific technique for reading blood pressure manually. The keywords are systolic blood pressure and the process of deflation. Systolic pressure, the higher number, represents the pressure when the heart beats, and it's indicated by the first appearance of the tapping sound, correct cough sound D, as the cuff deflates. The sound disappearing indicates diastolic pressure. Remember, the first tap marks the systolic number. Question 17. A PCT is about to enter the room of a patient on contact precautions. Which PPE should be donned before entering the room? A. Gloves and gown. B. Mask and face shield. C. Sterile gloves and gown. D. Gown, gloves, and mask. Answer A. Gloves and gown. This question tests the correct application of personal protective equipment, PPE, for specific isolation types. The keyword contact precautions signifies direct or indirect contact with the patient or their environment. For contact precautions, gloves and a gown are mandatory PPE to prevent transmission. A mask and face shield, B, are typically for droplet or airborne precautions, sterile gloves, C, are for sterile procedures, and a mask, D, isn't routinely needed for contact isolation unless the patient has specific respiratory symptoms. Always put on PPE before you enter the room for required precautions. Question 18. A PCT suspects a patient is being subjected to neglect. What is the PCT's responsibility? A. Confront the suspected abuser directly. B. Ignore the situation, assuming it's not their place. C. Report the suspicion to the nurse or supervisor immediately. D. Ask the patient if they are being neglected. Answer C. Report the suspicion to the nurse or supervisor immediately. This question covers ethical responsibilities, specifically the mandatory reporting of suspected abuse or neglect. The keyword suspects neglect requires knowing the correct protocol. PCTs are obligated to report concerns to their supervisor or the nurse, who will then follow facility procedures for investigation and reporting to appropriate authorities. Confronting the suspected abuser, A, could escalate the situation or put the PCT at risk, and asking directly, D, might cause the patient distress or compromise an investigation. Never ignore suspected abuse. Report it through the proper channels. Question 19. When assisting a patient who uses a walker to ambulate, what is the PCT's role? A. Walk ahead of the patient to clear the path. B. Stand behind the patient, ready to assist if they start to fall. C. Hold onto the walker firmly to guide the patient. D. Walk beside the patient without physical contact. Answer B. Stand behind the patient, ready to assist if they start to fall. This question tests safe practices when assisting patients with mobility aids like walkers. The keyword walker and the goal of safe ambulation are key. The PCT should walk slightly behind and to the side of the patient, maintaining contact with the gait belt or the patient's waist, to provide support and prevent falls if the patient loses balance. Walking ahead, A, offers no support, holding the walker firmly, C, hinders the patient's natural gait, and walking beside without contact, D, provides insufficient safety support. Position yourself slightly behind the patient, prepared to catch them. Question 20. A patient has an order for strict intake and output, I&O, monitoring. Which fluid the patient consumes should the PCT measure? A. Ice chips consumed by the patient. B. The amount of fluid remaining in a water pitcher. C. Only liquids served on the meal tray. D. Gravy eaten with the meal. Answer. A. Ice chips consumed by the patient. This question focuses on accurately measuring fluid intake, which requires understanding what counts as intake. The keywords strict intake and output and measure are important. Ice chips melt and become liquid once ingested, so their volume must be converted, typically half the volume of the ice, and recorded as intake. Gravy, D, is usually considered food, not fluid, unless it's very thin, and pitcher fluid, B, is intake potential, not consumed intake. Only measuring tray liquids, C, is incomplete. Remember that anything that turns to liquid at room temperature or body temperature counts as intake. Question 21. A patient expresses fear about an upcoming procedure. What is the best way for a PCT to respond? A. Don't worry, everything will be fine. B. Many patients feel that way before a procedure. C. You should talk to your doctor about your concerns. D. Change the subject to a more pleasant topic. Answer, B. Many patients feel that way before a procedure. This question assesses empathetic communication skills. The key here is validating the patient's feelings. Option B acknowledges the patient's fear. Many patients feel that way, which is a form of validation and shows empathy without making unrealistic promises, everything will be fine, or completely redirecting the conversation. Option C is also valid but less immediately empathetic. Acknowledging feelings helps build trust. Try validating their feelings by letting them know they aren't alone. Question 22. In many healthcare facilities, code blue indicates what type of emergency? A. Fire. B. Severe weather. C. Cardiac or respiratory arrest. D. Active shooter situation. Answer, C. Cardiac or respiratory arrest. This question tests familiarity with common emergency codes used in healthcare settings. Code blue is universally recognized as signaling a medical emergency requiring immediate resuscitation, typically cardiac or respiratory arrest. The keywords are code blue and emergency. Knowing these codes is crucial for a swift and appropriate response. Fire, A, is usually code red, weather, B, and shooters, D, have different designations. Always learn your facility's specific emergency codes. Question 23. When lifting a heavy object, what is the most important principle of body mechanics for a PCT to follow? A. Bend at the waist, keeping legs straight. B. Lift with your back muscles to get a strong pull. C. Keep feet close together for a stable base. D. Bend your knees and hips, keeping your back straight. Answer, D. Bend your knees and hips, keeping your back straight. This question focuses on preventing injury by using proper body mechanics during lifting. The keywords lifting a heavy object and body mechanics highlight the need for safe techniques. Bending the knees and hips, maintaining a straight back, and keeping the object close to the body uses the stronger leg muscles and reduces strain on the back. Bending at the waist, A, or lifting with the back, B, can cause severe injury, and keeping feet close together, C, provides a less stable base. Always bend your knees, not your back, when lifting. Question 24. When instructing a patient on collecting a sputum specimen, what is the most important instruction? A. Rinse the mouth with water before coughing. B. Drink plenty of fluids the night before. C. Collect sputum after eating breakfast. D. Breathe normally through the nose during collection. Answer: A. Rinse the mouth with water before coughing. This question covers the correct procedure for obtaining a sputum specimen, which is coughed up mucus from the lungs. The keyword sputum specimen and the instruction focus are key. Rinsing the mouth with plain water, A, helps remove contaminants like food particles or bacteria, ensuring the sample truly represents sputum from the respiratory tract. Drinking fluids, B, is good generally but not the primary instruction for collection accuracy. Collecting after eating, C, might introduce food, and breathing through the nose, D, isn't the main point compared to sample purity. Ask patients to rinse their mouth before coughing to get the cleanest sample. Question 25. While giving a bed bath, the PCT notices a red, intact area of skin on the patient's sacrum. What should the PCT do? A. Massage the area vigorously to improve circulation. B. Apply a protective barrier cream to the area. C. Document the finding and report it to the nurse. D. Cover the area with a dry dressing. Answer: C. Document the finding and report it to the nurse. This question addresses skin assessment during patient care. The finding of a red, intact area, often a stage 1 pressure injury, on the sacrum is significant. The keywords red, area, and sacrum indicate a potential problem. The PCT's role is observation and reporting. Direct intervention like vigorous massage, A, could worsen the skin, and while barrier cream, B, or a dressing, D, might be used later, the first step is reporting the observation to the nurse for proper assessment and care planning. Always report skin changes you observe to the nurse. Question 26. A patient's family member is upset because the patient is not receiving pain medication as frequently as they desire. What is the PCT's best initial action? A. Tell the family member that the patient is exaggerating their pain. B. Immediately give the patient more pain medication. C. Listen to the family member's concerns and then inform the nurse. D. Tell the family member that the medication schedule cannot be changed. Answer: C. Listen to the family member's concerns and then inform the nurse. This scenario tests communication and problem-solving skills when dealing with patient advocates. The keywords upset family member and pain medication highlight the situation. The PCT should first listen empathetically to the family's concern, C, to acknowledge their feelings, then report the issue to the nurse, who is responsible for pain management assessment and administration. Giving medication without authorization, B, dismissing the concern, A, or stating policy rigidly, D, are inappropriate actions. Addressing concerns respectfully and involving the nurse is key. Question 27. Which of the following is the most effective way to prevent the spread of healthcare-associated infections, HAIs? A. Wearing gloves for all patient contact. B. Regularly cleaning patient rooms with disinfectant. C. Performing thorough hand hygiene before and after patient contact. D. Isolating all patients with known infections. Answer: C. Performing thorough hand hygiene before and after patient contact. This question probes the most critical component of infection control. While gloves, A, cleaning, B, and isolation, D, contribute, the single most effective measure universally recognized for preventing HAIs is meticulous hand hygiene. The keywords most effective point to the foundational practice. Proper hand washing or using alcohol-based hand rub kills microorganisms and breaks the chain of infection. Think of hand hygiene as your primary superpower against germs. Question 28. When applying a gait belt to a patient, where is the safest place to position the buckle? A. Directly over the patient's spine. B. Off to the side, allowing for easy access by the PCT. C. In the front center of the patient's abdomen. D. In the back center, below the waist. Answer, B. Off to the side, allowing for easy access by the PCT. This question focuses on the correct application of a gait belt for safety and effectiveness during transfers or ambulation. The keyword safest place for the buckle is important. Positioning the buckle off to the side, B, makes it easier for the PCT to grasp securely during movement and helps prevent direct pressure or discomfort on the patient's spine or abdomen. Placing it directly on the spine, A, could cause injury, and the front center, C, or back center, D, might be less accessible or comfortable depending on the patient's position and the specific task. Always position the gait belt buckle to the side for better grip and comfort. Question 29. A PCT is counting a patient's respirations. How long should the respiratory rate be counted? A. 15 seconds, then multiply by 4. B. 30 seconds, then multiply by 2, if regular. C. 1 full minute, regardless of regularity. D. 45 seconds, then divide by 3. Answer, C. 1 full minute, regardless of regularity. This question tests the correct method for measuring respiratory rate to ensure accuracy. The keywords counting respirations and ensuring accuracy are key. While multiplying by 4 or 2 is common for regular rhythms, counting for a full minute, C, provides the most accurate rate, especially if the rhythm is irregular. Counting for only 15 or 30 seconds can lead to significant errors if the pattern changes during that shorter period. For the most reliable count, always aim for a full minute. Question 30. A PCT overhears a conversation between two nurses discussing a patient's confidential medical information in the cafeteria. What should the PCT do? A. Join the conversation and offer their opinion. B. Ignore the conversation, as they were not directly involved. C. Speak privately to the nurses afterward about HIPAA. D. Report the incident to the charge nurse or supervisor. Answer, D. Report the incident to the charge nurse or supervisor. This situation addresses patient confidentiality breaches and HIPAA regulations. The keywords confidential medical information and cafeteria highlight the inappropriate disclosure. While speaking to the nurses privately, C, might seem direct, reporting the incident through official channels. D, ensures it's handled according to facility policy and protects the patient's privacy rights effectively. Ignoring it, B, fails to address the breach, and joining in, A, would be unprofessional and a further violation. When you see a potential privacy violation, report it up the chain of command. Question 31. Which condition places a patient at the highest risk for falls? A. Patient who recently started a new vitamin supplement. B. Patient who requires assistance with ambulation due to weakness. C. Patient who is NPO, nothing by mouth, before surgery. D. Patient who prefers to sleep during the day. Answer, B. Patient who requires assistance with ambulation due to weakness. This question assesses the ability to identify high-risk factors for falls. The keyword highest risk requires prioritizing potential hazards. While other situations can contribute to falls, significant physical weakness requiring assistance, B, directly impacts a patient's mobility and stability, making them inherently more prone to falling. Vitamins, A, being NPO, C, or sleeping patterns, D, are generally lower risk factors compared to overt physical weakness. Always be extra vigilant with patients who have known mobility issues. Question 32. When assisting a patient who has dysphagia, difficulty swallowing, what is the most important precaution? A. Offer the patient large bites of food. B. Encourage the patient to drink liquids rapidly between bites. C. Ensure the patient is sitting upright during and after feeding. D. Allow the patient to lie down immediately after eating. Answer: C. Ensure the patient is sitting upright during and after feeding. This question focuses on safe feeding practices for patients with dysphagia. The keyword difficulty swallowing, dysphagia, is critical. Maintaining an upright position, C, during and for a period after feeding, usually 30 to 60 minutes, helps prevent aspiration, which is when food or liquid enters the lungs instead of the stomach. Large bites, A, rapid drinking, B, or lying down immediately, D, all increase the risk of aspiration. Remember to keep patients upright after meals to prevent choking or aspiration. Question 33. A PCT is assisting a patient with passive range of motion, ROM, exercises for the shoulder. What is the correct technique? A. Move the patient's arm quickly through its full range. B. Support the limb being exercised, moving it smoothly at the joint. C. Ask the patient to actively move their arm as much as possible. D. Perform the exercise only if the patient requests it. Answer: B. Support the limb being exercised, moving it smoothly at the joint. This question tests the understanding of performing passive range of motion exercises. Passive ROM means the caregiver moves the joint for the patient. The keywords passive range of motion and shoulder are important. The correct technique involves supporting the limb properly and moving it smoothly and gently through its available range of motion, avoiding jerky movements or forcing the joint. Active ROM, C, involves patient participation, quick movements, A, can cause injury, and waiting for requests, D, might delay necessary care. Support the joint and move slowly and smoothly during ROM exercises. Question 34. A patient rates their pain as 7 out of 10. Which intervention should the PCT consider first? A. Offer a back rub to help the patient relax. B. Ask the patient to rate their pain again in 30 minutes. C. Report the pain level and any relevant observations to the nurse. D. Provide distractions like television or reading material. Answer: C. Report the pain level and any relevant observations to the nurse. This question addresses the PCT's role in pain management assessment and reporting. The keyword 7 out of 10 indicates significant pain requiring attention. The PCT's primary responsibility is to communicate this subjective data, the pain rating, along with any objective observations, like grimacing or guarding, to the nurse promptly. The nurse will then determine the appropriate intervention, which might include medication or other therapies. Options A, B, and D are potential interventions but should only be implemented after the nurse is aware and has directed the care. Always report pain that needs intervention to the nurse first. Question 35. A PCT finishes using a sterile dressing kit. How should the used supplies be disposed of? A. Place all items in the regular trash bin. B. Place sharps in a puncture-resistant sharps container. C. Rinse the items before disposal. D. Place used gloves in the sterile field. Answer: B. Place sharps in a puncture-resistant sharps container. This question focuses on the correct disposal of potentially infectious waste, especially sharps. The keywords use dressing kit and disposed are crucial. Any potentially contaminated sharp item, like scissors or a needle if included, must go into a designated puncture-resistant sharps container immediately after use to prevent accidental sticks. Regular trash, A, is inappropriate for sharps or heavily soiled items. Rinsing, C, is unnecessary and wastes water. Used gloves, D, go in the biohazard or regular trash, not left on a sterile field. Safety first, sharps always go in the sharps container. Question 36. A PCT needs to transfer a patient from the bed to a wheelchair using a transfer belt. The patient is able to partially bear weight. Which type of transfer is most appropriate? A. Full lift transfer using a mechanical lift. B. Sliding board transfer. C. Two-person carry. D. Stand pivot transfer using the belt. Answer, D. Stand pivot transfer using the belt. This question involves selecting the correct transfer method based on patient ability. The keywords partially bear weight and transfer belt suggest the patient can participate. A stand pivot transfer, D, utilizes the patient's ability to stand or pivot with assistance and support from the belt. A mechanical lift, A, is for non-weight bearing patients, a sliding board, B, is for limited leg strength/weight bearing, and a two-person carry, C, is typically for fully dependent patients. When a patient can bear some weight, encourage them to help using a stand pivot method. Question 37. A competent adult patient refuses a treatment recommended by the doctor. What is the PCT's role? A. Try to persuade the patient to accept the treatment. B. Document the patient's refusal and report it to the nurse. C. Administer the treatment anyway, as the doctor ordered it. D. Inform the patient that they cannot refuse the treatment. Answer, B. Document the patient's refusal and report it to the nurse. This question concerns respecting patient autonomy and rights, particularly the right to refuse treatment. The keywords competent adult patient refuses are critical. Competent adults have the right to make their own healthcare decisions, even if those decisions seem unwise to others. The PCT's role is to respect this decision, document it accurately, and communicate it to the nurse, who will ensure the physician is informed. Persuading, A, overriding, C, or forbidding refusal, D, violates patient rights. Always respect a competent patient's right to decide about their own body. Question 38. A PCT notices that a patient's bed alarm is not functioning. What action should the PCT take? A. Turn off the alarm and attempt to fix it themselves. B. Continue to monitor the patient closely without the alarm. C. Report the malfunctioning alarm immediately to the appropriate department, e.g., maintenance or nurse. D. Ask another patient to keep an eye on the bed. Answer, C. Report the malfunctioning alarm immediately to the appropriate department, e.g., maintenance or nurse. This question deals with equipment safety and reporting procedures. The keyword not functioning and bed alarm relate to patient safety, specifically fall prevention. Malfunctioning equipment must be reported immediately through proper channels, c, so it can be repaired or replaced, ensuring patient safety is maintained. Attempting self-repair, A, is outside the PCT's scope and could be dangerous. Relying on close monitoring, B, or another patient, D, is insufficient and risky. Report broken equipment promptly, don't try to fix it yourself. Question 39. Which method is generally considered the least accurate for measuring core body temperature in an adult PCT setting? A. Temporal artery, forehead scanner. B. Tympanic ear thermometer. C. Axillary armpit measurement. D. Oral measurement with a digital thermometer. Answer C. Axillary armpit measurement. This question asks to identify the least accurate common method for measuring body temperature. The keywords least accurate and core body temperature are important. Axillary temperature, C, is taken on the skin surface of the armpit and is influenced by environmental factors and requires longer measurement time. It reflects surface temperature more than core body temperature. Temporal, tympanic, and oral methods generally provide readings closer to the core temperature. Always remember axillary temperatures are less reliable than oral or rectal readings. Question 40. When performing oral care for an unconscious patient, what position should the PCT place the patient in? A. Supine, lying flat on the back. B. Semi-Fowler's, head of bed elevated 30 to 45 degrees. C. Side lying position with head tilted slightly back. D. Side lying position with head turned towards the provider. Answer C. Side lying position with head tilted slightly back. This question tests safe oral hygiene practices for unconscious patients. The keyword unconscious patient and oral care are key factors. Placing the patient in a side-lying position, C, with the head angled forward slightly helps prevent aspiration. Secretions or fluids used for cleaning will drain forward out of the mouth rather than down the throat. Supine, A, increases aspiration risk. Semi-Fowler's, B, can still allow pulling towards the back of the throat, and turning the head towards the provider. D, doesn't facilitate drainage. Position unconscious patients on their side for oral care to prevent choking. Question 41. A PCT is documenting care provided. What is a key principle of documentation? A. Use vague terms to avoid being wrong later. B. Document care immediately after providing it. C. Use abbreviations freely to save time. D. Include personal opinions about the patient's behavior. Answer B. Document care immediately after providing it. This question relates to the principles of accurate and timely documentation. The keyword documenting care and the principle of timeliness are crucial. Documenting immediately, B, ensures accuracy, prevents forgetting details, and provides a real-time record of care. Vague terms, A, and undocumented abbreviations, C, lead to confusion and potential errors. Personal opinions, D, are unprofessional and have no place in medical records. Always chart promptly and objectively after you provide care. Question 42. A PCT is removing PPE after caring for a patient on droplet precautions. What is the correct order for removing PPE? A. Gloves, goggles, gown, mask. B. Gown, gloves, mask, goggles. C. Gloves, gown, goggles, mask. D. Gown, mask, goggles, gloves. Answer C. Gloves, gown, goggles, mask. This question tests the sequence for removing PPE to prevent self-contamination, specifically for droplet precautions. The keywords removing PPE and droplet precautions are essential. The general order is to remove items that are most contaminated first, gloves, then gown, followed by goggles/face shield, and finally the mask, often touching the ties or straps, which are less likely contaminated than the front. This sequence minimizes the risk of transferring pathogens to oneself or the environment. Remove gloves first, then gown, then goggles, then mask. Question 43. When assisting a patient to walk, the PCT should encourage the patient to A. Take short, shuffling steps. B. Look down at their feet constantly. C. Swing their arms freely to maintain balance. D. Lean heavily on the PCT for support. Answer: C. Swing their arms freely to maintain balance. This question focuses on safe ambulation techniques for patients. The keyword walk and maintaining balance are key. Swinging the arms naturally, C, helps counterbalance the body's movement and improve stability while walking. Looking down, B, can cause dizziness and unsteadiness. Shuffling steps, A, increase trip risk, and leaning heavily, D, prevents the patient from using their own muscles and makes it harder for the PCT to manage. Encourage natural arm swing for better balance when walking. Question 44. After collecting a urine specimen, what is the most critical step before sending it to the laboratory? A. Ensure the specimen container is full. B. Confirm the patient's identity and label the specimen correctly. C. Shake the specimen vigorously. D. Place the specimen in a clear plastic bag. Answer: B. Confirm the patient's identity and label the specimen correctly. This question highlights the crucial importance of specimen identification in preventing errors. The keywords urine specimen and sending it to the laboratory are critical. Misidentification can lead to incorrect diagnoses or treatments. Confirming the patient's identity against the specimen label, e.g., using two identifiers, and ensuring the label is accurate and complete before transport is the most critical step. Filling the container, A, depends on the test. Shaking, C, is usually wrong, and a plastic bag, D, is for containment, not identification. Always label specimens correctly with the patient before they leave your care. Question 45. A PCT is assisting a patient with dementia who becomes agitated during their bath. What is a recommended approach? A. Stop the bath immediately and leave the room. B. Restrain the patient until they calm down. C. Use a calm, reassuring tone and redirect the patient's attention. D. Force the patient to continue the bath quickly. Answer: C. Use a calm, reassuring tone and redirect the patient's attention. This question addresses managing challenging behaviors common in patients with dementia during personal care. The keywords agitated, dementia, and bath are important clues. A calm, reassuring approach, C, combined with redirection can often de-escalate agitation and help the patient feel safer. Stopping the bath, A, might be necessary if redirection fails, but it's not the first step. Restraints, B, are a last resort requiring specific orders and should be avoided if possible, and forcing the patient, D, will likely increase agitation. Approach agitation calmly and try redirection first. Question 46. What are the two most common identifiers used to confirm a patient's identity before providing care? A. Patient's room number and diagnosis. B. Patient's full name and date of birth. C. Patient's medical record number and floor assignment. D. Patient's photo ID and signature. Answer: B. Patient's full name and date of birth. This question tests knowledge of patient safety protocols, specifically patient identification. The keywords two common identifiers are central to preventing medical errors. Using the patient's full name and date of birth, B, are the standard, widely accepted identifiers in most healthcare settings before performing procedures, administering medications, or providing care. Room number, A, MRN, C, or photos, D, might be used in some contexts but are not the primary universal identifiers requested. Always check at least 2 identifiers before any intervention. Question 47. A PCT is asked to obtain an orthostatic vital signs measurement. What does this involve? A. Measuring blood pressure and pulse while the patient is lying down, sitting, and standing. B. Taking the patient's temperature rectally. C. Measuring blood pressure in both arms simultaneously. D. Assessing pulse rate while the patient performs light exercise. Answer. A. Measuring blood pressure and pulse while the patient is lying down, sitting, and standing. This question tests understanding of a specific vital signs procedure, orthostatic vital signs. The keyword orthostatic refers to changes related to standing up. This measurement involves taking blood pressure and pulse readings with the patient in 3 positions, lying, sitting, and standing, A, to detect significant drops in blood pressure or increases in pulse rate upon postural change. Rectal temperature, B, simultaneous BP measurement, C, or exercise assessment, D, are different procedures. Orthostatic vitals check for dizziness or BP drops when changing positions. Question 48. Standard precautions should be applied. A. Only when working with patients known to have infectious diseases. B. When performing invasive procedures only. C. To all patients regardless of their diagnosis or presumed infection status. D. Only when contact with blood or body fluids is anticipated. Answer, C. To all patients regardless of their diagnosis or presumed infection status. This question emphasizes the universal application of infection control principles. The keyword standard precautions implies a baseline level of infection control. Standard precautions are the minimum infection prevention practices that apply to all patient care, assuming everyone is potentially infectious. They include hand hygiene, use of PPE when contact with potentially infectious material is expected, and safe handling of equipment and waste, but they are applied universally, C, not selectively, A, B, D. Treat every patient as potentially infectious using standard precautions. Question 49. A patient who is weak and unsteady needs to move from the bed to a chair. Besides a gait belt, what is the most important safety measure the PCT should ensure? A. The patient wears non-slip socks. B. The chair is positioned close to the bed. C. The PCT wears gloves during the transfer. D. The pathway is clear of obstacles. Answer, D. The pathway is clear of obstacles. This question assesses safety priorities during patient movement. While non-slip socks, A, are helpful, clear pathways, D, are critical for preventing trips and falls during the entire transfer process. Positioning the chair close, B, is important but doesn't guarantee a safe path to the chair. Gloves, C, are for infection control, not directly for transfer safety. Ensuring the environment is safe and free from hazards is paramount before initiating any movement. Always clear the path before helping a patient walk or transfer. Question 50. A PCT is asked by a patient to perform a task that is outside their job scope, such as administering medication. What is the correct response? A. Perform the task if it seems simple enough. B. Explain that the task is beyond their role and find the appropriate person. C. Ask a coworker PCT to perform the task instead. D. Tell the patient they are not allowed to ask for that. Answer B. Explain that the task is beyond their role and find the appropriate person. This question tests understanding of professional boundaries and scope of practice. The keywords task outside job scope and administering medication are critical indicators. PCTs have specific duties and cannot perform tasks delegated only to licensed professionals like nurses, e.g., medication administration. The correct response is to politely decline, explain the limitation, and ensure the task is handled by the correct personnel. Performing the task, A, or having another PCT do it, C, is inappropriate delegation or scope violation, and telling the patient they cannot ask, D, is unprofessional. Know your limits and refer requests outside your scope to the right person.